So this one here is pretty mundane. This is herpes simplex or cold sores. This is a virus that most people carry. It causes fevers, small little lesions, usually around the lip area, but can also show up in other areas of the body. But mainly, it's always going to be right around the lip and chin area. It's going to cause what's called painful superficial ulcers. So they're not actually going to be very deep. They're just, one or two layers thick down, at the very surface, and they usually heal within a few days. But just like chicken pox, people that have this virus, they tend to carry it for life, and so it comes back and forth. So they end up having outbreaks on a regular basis. A lot of people get confused thinking they caught the disease again, but reality is it's actually a virus that you carry with you for life, and it just keeps getting re-triggered. And we'll see how that is here in a second. So the recurrent cold sores are called a herpes simplex labius. Usually it's going to be the first one you get is going to be very, very painful, very big. That's because your immune system hasn't seen it before. And then once the immune system's seen it after that first outbreak, it tends to not be as painful and usually able to control it a little bit better for people that get them on a regular basis. So the virus is HSV. We'll see in chapter 27 when we do the genital urinary tract infections, we'll see HSV2. So this is HSV1, herpes simplex virus 1. And of course, a lot of K through 12s like to make jokes about this, say you got herpes, when you have a cold sore. Well, it's true technically. But the actual sexually transmitted one is HSV2. And we'll see that there's problems with the fact that we're actually seeing a lot of HSV1 in genital areas and HSV2 in oral areas because of sexual preferences. We'll cover that more in chapter 27. That's why it says here most oral infections and most, usually urogenital infections. That's because sometimes we do see them cross. So they go into latent, just like chickenpox does. It goes back into your nervous system and can be reactivated. So usually what's going to happen when it gets reactivated is you've had some sort of stressor event. So it could be sunburn, it could just be life stresses, it could be pregnancy, lots of different things. Whatever causes the hormonal balances or causes damage to the skin, such as a sunburn, can cause the virus to want to jump back out, because what's the virus trying to do? It's trying to survive. And so if it feels like the organism that it's currently hiding in is taking a turn for the worst, it's going to jump out as a cold sore, and that's when you're actually infectious. You're not infectious when you don't actually have a cold sore. It's only when you're presenting that cold sore that you're infectious. That's the virus trying to get the heck out. And so usually it's going to happen during some sort of stressor event. This one's out of turn, so you skip ahead one. Unfortunately, that slide I'll have to come back to. The epidemiology is that you usually get the HSV1 as a child. Sometimes it's due to the fact that what do people want to do to a baby when they see it? Kiss it, love it, right? Then you spread a cold sore to it. So over 90%, whether you may or may not, sitting here in this room, ever had a cold sore, actually manifests itself. Over 90% of us actually carry the virus because we acquired it so early in childhood as basically infants. And only 1 in 3, though, are going to actually present cold sores on a regular basis. And then it even becomes a smaller number of those that actually have more than 1 or 2 outbreaks a year. Some people, unfortunately, get them almost on a monthly basis. The virus is transmitted by close contact, but also can survive for several hours on plastics or fomites, right? So in this case, it may not be from somebody kissing. It could be just that you touched something somebody else touched and gave it to yourself that way too. Thus why we have such a high percentage of people that carry the virus. Treatment and prevention, these 2 drugs came out about a decade or so ago, acyclovir and penciclovir. These are both targeting the polymerase, so that third type of antibiotic. You know, this is a virus, but the same idea as the antibiotics, where it's affecting the ability of the DNA to replicate. Because this is a virus, it is a DNA virus, it carries its own polymerase on board, and if we can actually shut that polymerase down, it can't replicate. And so people that have HSV1, HSV2, even shingles, anything that's within that herpes family, we'll see acyclovir is actually the drug of choice, shuts down that polymerase, and it actually minimizes the amount of outbreaks that these people have. All right, so back up to mumps. The next one's mumps, another virus of the upper digestive system. Again, this was part of the diseases you just usually contracted as a child in the 40s, 50s, 60s, and before. And so this one's marked by fever, a little bit of loss of appetite, and a headache. But then what happens when it actually manifests, where we're able to tell it's mumps, is that the parotid glands right here are going to start to become painfully swollen. They have a lot of trouble swallowing, which is also probably why they don't have an appetite. And then sometimes we'll actually end up getting spasms in those muscles because everything's so tight, which makes talking and chewing really difficult. And we can get symptoms elsewhere in the body, especially in adults that acquire mumps. Usually as a child that acquires them, it's going to be a very simple few days, a little bit of swelling in the throat area, and it goes away. In an adult, we can actually get these problems, just like getting chickenpox as an adult is a terrible thing. Getting mumps as an adult can actually push forward into headaches, stiff neck, which then is going to be indicative of meningitis. And that's the last chapter I may not be able to lecture on, but it is on the final, is the nervous system disease. It's a very, very small chapter, but it is very important because meningitis is basically the end of the game. Remember, we have all these defenses along the way. You have your skin, your mucous membranes. You have all these virus patches in the intestines, which is what we're talking about now is the digestive diseases. Gets into the blood. We got lots of immune system functions in the blood. But then once it crosses over into the meninges, into the nervous system, we start seeing fatality rates really skyrocket. And so having meningitis is never a good thing. It's always usually going to be, depending on what type of meningitis we're talking about, it can be fatality rates as high as 90%, even with treatment. Pregnant women that get mumps, acquire mumps, can cause miscarriages. And sudden onset deafness has been reported over time, even in children. So sometimes because it is affecting the parotid gland so close to the ear canal and eardrums, it can cause damage and cause